Hi, this is Dr. Lundquist, and I wanted to talk to you a little bit about shoulder injuries. I don't know if you know this, but approximately 25% of all patients over the age of 50 come to the doctor and complain about some form of shoulder pain. And one of the things that we are seeing in our clinic is that there are different ways that the shoulder can actually be treated in order to get it better. And so I just thought I'd talk a little bit about some of the different types of shoulder injuries and then what treatment options are available for that. So let's take a look at the shoulder itself. And in doing so, that will help us identify the different areas that are problematic. So first thing we want to look at is bursa. You can see a bursa is a gel sac that sits over the joint and protects the tendons and the muscles from wear and tear. This bursa in particular is one of the largest in the body, but can cause a lot of inflammation. And when it gets severely inflamed, then it makes it hard for the shoulder to operate normally. And so you can get impingement shoulder from a bursitis, but also the rotator cuff muscles actually come down underneath this bursa, and so they can be affected, and you can get impingement shoulder from having these tendons, part of the rotator cuff tendons, that will end up causing problems again with your shoulder. One of the things that's interesting about the shoulder is that it is a ball and socket. You can kind of see the humerus as it comes around here with these rotator cuff muscles attaching, but it sits inside of that, and so it can move in a variety of different directions. You internally rotate, externally rotate when you lift and you decrease. That gives a lot of surface area, but it also creates the opportunity for a lot of injury to happen. Over time, when there's stress put on the shoulder, it's been overworked, it's been fallen on, it's been torn, all of this will lead to scar tissue, and you can develop different types of pains associated with it. Obviously, just joint pain and degeneration alone is called arthritis, and that can happen over time. And the treatment for arthritis is really to do things that are going to decrease inflammation. So there's different herbal supplements that can be used, things like turmeric, boswellia, or you can use anti-inflammatory medications like Motrin, Advil, Tylenol to help decrease the inflammation. But some of those carry a side effect profile that is not great, like gastric bleeding for long-term use, or it can be damaging to your liver or your kidneys. Other things that can help promote joint healing are collagen peptides, glucosamine chondroitin, and MSM. All of those help in supporting the body to be able to recover. One of my most recent discoveries that I'm really excited about is specialized pro-mediators that help support the body in resolving or healing up damage to tendons, as well as the joint capsule itself, the cartilage. These resolvents or SPMs can be really helpful at healing the body from that standpoint. When you look at the joint itself and inside the humeral head and the shoulder, there's a cartilage called the labrum. The labrum can get torn, and sometimes that can get stuck, and so patients can have difficulty in moving their shoulder without having it be full range because of that compromise to the labral head. And so that's something that should be considered when people are having shoulder pain. And then, of course, with the bicep tendon coming in and the deltoid, you can get tendinitis or tendinosis with these different tendons that can also lead to joint pain. And lastly, you can get a labrum tear, or not a labrum, sorry, a ligament tear with the acromion clavicular ligament here, or the acromion and the coracoid process of ligament. There's 4 ligaments here that can be torn slightly, and those can cause problems. Those usually take a little bit longer to heal than tendinitis, but all of these things can be associated with shoulder pain. So it's important to know what kind of problems that you're actually having. One of the things that we're really excited about is Dr. Hazen, our chiropractor, has now become certified in doing ultrasound. So in in addition to MRIs, which are a great way to look at this, this is a very cost-effective way to look at the shoulder. The nice thing about ultrasound is you can actually look at it while it's moving and see where some of the damage is and where some treatment. When it comes to injection therapy for treatment for the shoulder, the options include a steroid injection or hyaluronic acid into the joint to try and help promote healing. Problem is that steroids can have some side effects associated with it, is it will impair the immune system's ability to get in and repair and keep out infection. And so often, although it decreases the inflammation, it won't actually promote healing as well. Some of the things that we have been doing here in our practice have been ozone therapies, as well as stem cell or biological allograft treatments, as well as PRP to help that shoulder heal. Now, shoulders, because they're ball and socket, tend to be a little bit harder to treat than, say, knees, which are hinges, or ankles, which are hinges. But we are still seeing a pretty significant success rate with our shoulder treatments, somewhere up in the 70 to 75% range. So if you're having shoulder issues and this is something that you would like to pursue or learn more about treatment options, please come visit us at Temecula Center for Integrative Medicine at our regenerative clinic, and we're happy to help you get along and improve your overall treatment and improve your satisfaction.